Hello, beautiful people. Welcome back to the channel. CVS is hiring. Cigna is hiring. American Cancer Society is hiring as well. These are all fully remote job leads. Okay. So I know like there's this idea out there that fully remote jobs are no longer available. I do want to just start off by saying that yes, there is some truth to it. However, there's still a lot of opportunities out there. These companies that I'm talking about today in today's video that I'm going to be sharing some roles that they have, they continue to hire fully remote positions. So if you are in the market, I encourage you to continue to search. Do not give up just yet. There are opportunities out there. You just have to find them. Okay. If you've not leveraged LinkedIn, leverage LinkedIn. I am going to be doing a video very, very soon. I promise, to kind of talk about how to leverage ChatGPT, for example, to maximize your time, because right now there's so many opportunities out there, and a lot of time one of the things that I'm noticing is that, at least with questions I get, oftentimes people are so bogged down with trying to customize their resume to suit whatever the job requirements are. In some cases, tailor it so that is more in alignment with whatever the job is asking for, that you get bogged down by that at the time you are even submitting your application, the pool is already too full, that the algorithm has already even kicked out your application before they even get to review it. So we don't want that. I don't want that for any of you guys. So I'm going to be doing a video that is going to focus on how to get things done in minutes, and you have to leverage AI to be able to do that. So that's not today's video. Okay, I do have 3 opportunities I wanted to quickly come on here and share with you guys. Let's dive right into those opportunities. The first one is with Cigna. As you can see on my screen share right here, this was just posted. Cigna is a health insurance company. They are pretty big. They are one of the top 10 in the US in terms of health insurance companies. Their magnitude is quite large, and they span across all 50 states. They even have international offerings as well. So they are really playing on the global field. Anyone landing a job with Cigna will be set because the benefits are great. They have a high stake in the insurance industry. So if you are able to get in there, you have opportunities to be able to move around. You have opportunities to continue to have employment for a very long time because they are so large. If you're tired of whatever role got you in, you can always just apply for a new one. So that's the beauty of being part of a big company, because it allows you the opportunity to just move around. And as you meet people, get to know other people, your higher probability of getting your next job is a whole lot higher, right? So that is one of the advantages of working for a global conglomerate like Cigna, and pretty much all the 3 companies we're going to be talking about today. All right. So with that being said, right, what exactly is this role about? This position is fully remote. You see it right here, remote USA. So which means that you do not need to reside in any particular state. As long as you are in the United States, you can apply for these positions and potentially get them. The title of this particular role is Individual and Family Plans Quality Review and Audit Analyst. I know, it's a mouthful. So what does that even mean? Some of you have heard of the exchange plan. Some people have heard of kind of Medicaid extended plans. All of those are all IFP. So Obamacare, right? Some people call it that. So all of those are all IFP plans. They are basically affordable plans that the government basically came up with as a way to help cover the lots and lots of people that have no health insurance. So where people were being extremely burned out because of their medical bills and not having health insurance, because most of the times it was either you qualify for Medicaid or you were getting your insurance through your job. And most people lost their jobs at a time, and they did not have health insurance coverage because they just could not afford it. So this was kind of that middle option for people. So if you are out of a job, or in some cases what your job is offering is just too high, you can leverage this opportunity because it's only going to be based on your salary, also taking into account the rest of your other bills. So it's not going to make you pay so much money that you cannot afford it. So it was kind of tailoring multiple factors, bringing them all together and providing coverage for people. So that's really what it is. So Obamacare, it came out of the Affordable Care Act. It's IFP, it's Medicaid extended, whatever most people know it by. But really, the bottom line is this is just an insurance coverage opportunity for people that are not eligible for Medicaid, but do not have the finance to be able to pay out of pocket because it's so expensive, and also may not have the option to have insurance through their jobs, and most cases, small business owners, etc. So this is really what this group of folks are. So anyone that has the exchange plan, they will all fall into this bucket. So this individual is going to be someone that will be performing quality review for this particular subset of coverage for people. So this individual is going to be auditing and making sure that everything that they ought to do, provide services, benefits, etc., is going to be providing such audits to ensure that they are doing what it's supposed to do. What exactly does this job entail? The Risk Adjustment Quality and Review Analyst in IFP brings medical coding and hierarchy, basically condition category expertise to the role, evaluates complex medical conditions, determine compliance of medical documentation. They're going to bring all of that experience and expertise together and then help to provide a documentation that is seamless. That's really what you're going to do, help identify any type of trends potentially. This group, are they basically seeing folks with more diabetes, folks with more cancer, whatever the case may be, and then be able to tailor those trends as well as data points to create better benefits for people going forward. That's really what it is. Continuous quality improvement. A little bit more, it talks about ICD-10, it talks about HCPCS, all of that is very, very pertinent to this role. It also talks about CMS. CMS is for Medicare, Medicaid, SNP programs, DSNP, all of that fall under the category of CMS. So CMS tend to kind of provide this governance over all of these plans to ensure that there are no quality lapse. So they want to make sure that they do publish a lot of code etiquettes. They publish a lot of information that they put out there on a regular basis to keep people from being basically flawed by the system. There's a lot of fraudulent activities happening in the insurance world. It's very, very interesting. This individual would kind of be a very vital part of making sure that such things are not happening. If they happen, catch them, report them, and get escalation steps involved to remedy them as quickly as possible. That's really what it is. Audit is all about that. They go further to talk about the specific experience you're looking for. They're looking for somebody with a high school diploma. If you have GED, I'm sure that will count as well. At least one of the following certifications. So remember, we talked about being heavy in coding, right? Medical coding. It makes sense that they are looking for somebody that is a professional coder, right? So someone who has certification in medical coding. They also talk about RIA, RIT as well. So individuals who have a certification other than the CRC. So CRC is basically the Certified Risk Adjustment certification, must become CRC certified within 6 months of hire. So CRC is what you're really looking for, right? The Certified Risk Adjustment Coder. So if you have that, you don't need the others. But should you not have the CRC, they're saying that they want you to have the CRC within 6 months of being hired. So then they talk about minimum qualifications, ICD-10 knowledge, someone who has done medical documentation, medical charts review before. They talk about HCC coding experience is as a preference, but it's not needed. They also talk about computer competency with Excel, Word, Acrobat, Adobe. All of that are important. To be honest, Microsoft, Adobe, etc., they are all important for every job. So if you are looking to get a new job, I always tell people this: brush up on a lot of things, especially your Excel skills, right? If you have not used Excel in a while, don't stop using Excel, guys, okay? I do want to just start off by saying that do not stop using Excel. Even if the job you find yourself in does not require you to use it, on a personal side, just continue to use it, continue to develop your skills, because that is so important. And with Excel, with Power BI, Tableau, and all these things, from personal experience, if you don't use them, you lose them. It's so important to make sure that you are keeping those skills going. Find ways to keep them going. You can practice outside of work. You don't have to be at a job to be able to practice these things. So important. All right. The salary for this position is between $25 and $38 per hour. Again, $25 to $38 per hour is this salary. I know I cannot talk a lot about this role. If you have any specific questions about it, please come back, leave it in the comment section. I am very interested in having conversation about this. So I have a lot of auditing background. I have done a lot of internal audits in my lifetime, quality audits. I am in the healthcare space. If you can see, my passion already is something that I just have a very strong passion. If you have any questions, please feel free to let me know. All right. So the next opportunity that I want to talk about is with American Cancer Society. So they're looking for someone to come on board and help with gathering information, documentation, pretty much. So the title is Cancer Information Specialist is what they titled it as. And as you can see, it is full-time and it's also fully remote. This position, however, if you are interested in this position, I do want to just keep in mind that they are looking to close it very quickly, because you can see that the start date is April 28th, which means that this position needs to be interviewed, hired, and ready, trained, everything in the next month and a half, pretty much. Okay, so if you know that works for you, then you should definitely go for it, because I know sometimes people want to take some time off from their previous work. They want to take some time to let their job know. So there are many aspects to that. So I wanted to just quickly call that out so that people know that this is a role that is going to quickly want to hire. So it's going to go off the market very quickly. If that sort of fits into your need, then definitely go for it. So with this opportunity, it says it right here, ACS patient programs are matched to patients' needs. It says inquiries are answered primarily by telephone, and there are limited opportunities to address via, so they do digital channels as well, social media, email, online chat, and video chat. So they do provide service in all of those mediums. So wanted to also call that out. Primarily, it's telephonic. However, they do have all these other options to ensure that they are, meeting the demands of their patients. So that's pretty much it, helping to just navigate patients through the process, answering any questions they may have. It does say here, bachelor's degree or equivalent, preferably in healthcare, 1 year relevant experience in social work, public health, or customer service is preferred, but it's not required. They also talk about, having contact center experience, call center experience, all of that makes sense. And the salary is $21.25 per hour. Again, $21.25 per hour is the salary. All right, so we're going to move on to the next position, which is right here with CVS. I've talked about CVS multiple times on this channel. Whenever I see an opportunity with them, I always want to bring it back. So they do have this opportunity right now. This is a customer service role, and it is in the provider sector. So what does that mean? So you can provide customer service to members or patients, or you can provide customer service to doctors or providers that see those patients. So this particular role is catered towards providers. So providers always have questions about maybe prior authorizations they put in, about certain benefits or certain services. They want to do a surgery for a patient. They just have a couple of questions around it. They want to make sure they will get paid, basically. So this individual is going to be providing such service to providers. That's basically it. They are asking for this individual to have high school diploma or GED. That's pretty much it. They also talk about it being fully remote position, which we already know. They talk about having familiarity with Microsoft Office products. Like I mentioned before, that's just expected. They also talk about being able to manage multiple projects, multiple screens, someone who is very versatile, who can actually thrive under any environment, stressful environment, someone who is very malleable, someone who is collaborative. all of that is important for this position. And the salary is $17 to $28.46 per hour. That is the range. So depending on where you reside is going to determine where you fall in that bracket. So those are the three opportunities, guys. I wanted to come on here and share these three with you guys and also give you my thoughts about them, why I felt they were a good fit, and also why I think they can potentially work for you, anyone that is watching. So if you have any questions, like I said from the beginning, please leave it in the comment section. I really want to interact with you guys. I want to know exactly how you're doing, what exactly are your pain points, how can I help? So please let me know. If you have any specific questions or comments, leave them in the comment section. Like always, the links to these specific roles will be in the description of this video so you can easily access them. Yeah, so that's it, guys. So I will talk to you guys in the next video. Please take good care of yourself, and I will catch you in the next one. Take care, guys. Bye-bye.